It may seem unusual to think of headache coming from the neck and shoulder area, but it does. It's quite common. It's usually quite easy to establish whether that is the case or not. Whilst headache can be severe enough to present with symptoms such as sensitivity to light, vomiting and aura, those symptoms generally tend to be obvious enough to be broadly classified as migraine, which are managed differently. So it tends to be the more lower grade persistent headaches which are most common and more problematic in finding a solution for. When people are trying to find a solution for this type of headache, usually they'll go through a process of elimination according to their lifestyle, taking into account certain habits, certain things that they do. For example, I'm dehydrated, I need to drink more water, or my caffeine intake is too high, I need to cut down on the coffee, the tea, or the chocolate. Maybe it's the office environment, with suffering from eye strain, artificial light, lack of fresh air, or maybe even just stress and tending to use painkillers in order to manage the headache. Often when people go through this process and find that nothing changes, it can be a natural progression to go and consult their GP about it. This can lead to prescription of strong painkillers or a referral to a specialist such as a neurologist or an ear, nose and throat surgeon. All the while, pain persists, headache persists, along with fatigue, frustration, lack of sleep and a general loss of enjoyment of life. Now you might be wondering, how can neck and shoulder tension cause headache? Well, muscles and joints in the neck have a shared nerve supply with patches of skin in the head, so it's a kind of pain referral pattern. What clues might you get that headache is coming from the neck and shoulder? Well, the obvious one would be if you're suffering neck pain and shoulder tension at the same time as a headache. You could have headache on one side, for example around the eye, around the ear, or at the base of the skull. There might be an activity element to it, so you might find that as you do more, the headache is less noticeable, and then when you do less, when you're sedentary, it comes on stronger. And there may be a 24-hour pattern to it, or a course of the day pattern where it worsens across the course of the day, usually associated with what's done in the occupation, either a sustained posture or a repeated action of the head or arm. If you've got a suspicion that headache is coming from the neck and shoulder, then how can you test it? Well, an easy one to do is to feel along the length of the neck and shoulder, feel along tight areas, and when you find a tender spot, a spot of soreness, apply some extra pressure to that, and that should cause either an increase or a decrease in the intensity of the headache. You can also stretch out a tight area, so after a few repetitions of stretching a tight muscle, you should also feel a difference in the headache, usually a reduction. You can try changing a few habits. Sleep, so when sleeping on the back, use less pillows, possibly even no pillow. You can, when working at a desk, try to avoid leaning forward, and definitely try to avoid leaning on one elbow. With the phone, try using the other hand instead of the one which you usually use, or a speakerphone. And when having relaxed sitting, place a cushion behind your head. So the easiest way to find out whether headache is being caused by neck and shoulder tension is through a physiotherapy consultation, where it can be established quite quickly what the cause of the headache is. Then you can get on with getting relief and getting back to enjoying life. If you've got any questions about headache and neck and shoulder tension associated with that, please do comment and I will get back to you. Otherwise, if you found the video helpful, go ahead and like and share. Thank you for watching.